Emergency department staff across Wales face a variety of challenges every day. Staff tell me that they're frustrated at the mistaken belief that people who access care in our emergency departments will have to wait over 4 hours to be seen by a doctor or a nurse. They tell me that this does not reflect the quality, compassion and the timeliness of care that they are delivering to people in Wales 24 hours a day, 7 days a week. It's time to change the conversation.
When the 4-hour target was first introduced, we felt it was a good thing. It meant that patients wouldn't be waiting unnecessarily for beds and their treatment would be timely. I think unfortunately it became a little bit of a stick to beat us with. That's how it sometimes felt, because it was 4 hours and it wasn't negotiable.
It has become very, very out of date. It doesn't break down what we do in the department. It doesn't look at all of the different aspects of emergency care that we give to patients on a daily basis.
Inevitably, some patients will have a greater clinical need than others. The acuity will be much higher, but we want to make sure that their care is safe and that they're not clinically compromised within that time frame.
Patients are at the heart of absolutely everything that we do, and our staff are dedicated to providing better quality of care, and it's about time we really change that conversation from just 4 hours to look at everything that we do for our patients.
As part of a Wales-wide collaboration with frontline staff and patient groups, we're striving to improve patient experience and the quality of care by introducing new measures, and crucially, these new measures have been designed by our staff and with our staff. We'll look at rapid early triage and then how quickly patients are assessed by a healthcare professional. They will also explore where patients go when they leave emergency departments.
Each of the new measures, time to triage, time to assessment by a clinician and onward travel from the emergency department, are all key aspects of the care we deliver to our patients. So by measuring each of these individually, it'll allow us to know what we can do to better improve the care that we give to our patients.
We've also launched new patient feedback system across all 13 of our emergency departments. This will enable us to listen to our patients and their experience and to make improvements based on that feedback.
For many years, patients have said, thank you, it's been a fantastic service. You've really looked after us really well, and we've never been able to capture that in a live way. And some will say it, some will write cards. There's no consistency. This is much more consistent because nobody's standing over them, nobody's watching them, and we can learn from the feedback that they give us, positive and negative.
I think it's very simple. I think can use it quickly, as can other people if we're in a hurry. And I think it will quite significantly improve the patient experience. I think it will improve my experience in the future. And I think it will contribute very positively to future developments.
We want our patients to know that we're listening and we want to act on what they tell us. We want to be able to address patients' concerns and praise our staff for what they're doing well. These measures are the first steps in looking at what does good look like for an emergency department.
We will look at the bigger picture, working with our frontline staff and patients together to improve patient experience and outcomes from the ground up.